For some of us, this life's journey is a difficult one, and it can feel especially overwhelming, particularly if we're struggling with issues such as anxiety, depression, post-traumatic stress, chronic pain, eating disorders, addictions, compulsive thinking, and many other symptoms. Destructive symptoms and conditioned belief patterns that the conscious thinking mind has difficulty resolving and letting go. And sometimes it may be hard to imagine a life without these uncomfortable feelings and life-limiting belief patterns. But we now know that it is possible. It is possible because we have a much deeper inner wisdom and inner spaciousness, a part of us that knows exactly how to fix things, even if the problem began long before we can remember.
No one else can heal you or fix you or change you. But of course, a lot of therapy models and a lot of therapists try and do that to people, and it doesn't happen. It just doesn't happen. And I guess the basis of the work that I've been doing for the last 35 years is based on that one single thing, that we are self-healing individuals. My job is to help my clients create an atmosphere within themselves where they can actually heal themselves or make their changes and make them in such a way that they're permanent. It's pretty simple, really. And I know it's a bit of a cliche, but the simpler we keep it, the better it works. The less involved we get, the better it works.
When a person is able to access their own deeper inner resources, this is when they are truly able to make real and lasting changes. We cannot see these different states of consciousness, but we know they exist.
The person does not need to know what it is that's causing the problem. We grow up in a society that worships this thinking brain, and look, the thinking brain's great, but it's limited, and the emotional brain sits underneath the thinking brain at a subconscious level. That's where the action is, and no amount of trying to analyze or rationalize or work out what is going on at that deeper level is ever going to get there.
See, people talk about the subconscious mind. I think there's a lot more to our subconscious than our subconscious mind. Our subconscious mind or mental activity is part of our subconscious self. But I see, we have a whole self. Part of it's conscious, part of it's subconscious. Part of the subconscious is, there's a whole bunch of physiological, neurological, psychological, biochemical, a whole bunch of stuff going on at a subconscious level that I would have difficulty thinking of it as subconscious mind. But subconscious mental activity, the mental emotional stuff, is just another part of that. And the thing that distinguishes is, I guess, anything, no matter what it is, anything that happens at a subconscious level happens automatically. We don't have to think about it. We don't have to try and make it happen. It just happens automatically. We're not aware of it. We can be aware of the end result of it, but we're not aware of the process going on inside.
Everything we have learnt, positive and negative, has been stored in our subconscious, most significantly as a very young child, and even before we were born, or at other times in life when we may have experienced shock or trauma.
I would say 9 times out of 10, our clients are here, grown-up adult clients are here, suffering the consequences of dynamics that have been established at a subconscious level. I'd say the vast majority probably before the age of 10 or 11 or 12 years of age, and some much earlier. There's very few things after 12, 13, 14, 15, there's very few things, very few times that something will happen that will keep on giving the person subconsciously based problems for the rest of their life. And if something happens at 30 or 40, some traumatic event happens, and they say, well, I've only ever had the problem since then, we can still, if we wanted to, probably still trace that back to some time earlier. The traumatic event has only triggered something off that was already there, some vulnerability that was already there.
Our consciousness is changing. For many people, there is now more of a shift into self-awareness and a need for intelligent, simple and effective healing modalities. Modalities that assist people at that much deeper level of their consciousness. Private subconscious mind healing, or P.S.H therapy in short, is at this higher level of understanding. The principal aim behind the therapy is to help people to access their own inner healing abilities at the real feeling cause of an issue, allowing for permanent and lasting changes to take place.
I see clients from approximately 7 years of age through until their 80s. I've seen clients and they bring all sorts of things that trouble them to me. I see people with chronic pain issues. I've seen people, and often those chronic pain issues have a trauma before them. I see people with, I see children who are anxious about things. I've seen people with depression and anxiety. You name it, anything that's troubling someone, if they haven't been able to heal it consciously with everything that they've done, then pounds of peanuts, it's a subconscious issue. And because that emotional part of our brain directly communicates with the autonomic nervous system, it can affect so many areas: sleep issues, weight issues, learning issues, anger issues, healing issues, skin issues, all sorts of things. It's quite, there's no limit really to what we can help someone to shift. Everybody's an individual and we all express our emotional trauma in different ways.
If an uncomfortable emotion can be created at that feeling level, then too, using our own inner wisdom, it can also be dissolved at that same level.
A conscious level problem is pretty much what it sounds like. It's something that you'll know you've got the problem and you'll have a pretty fair idea of what's causing it. Okay, that's maybe a little too simple, but that's the bottom line. Subconscious problems, there's no subconscious problems. People have conscious problems, but they're unaware of the subconscious causes of them. What I've said for many years now is if a person has feelings or behaviours or responses that they would like to change and haven't been able to change with willpower or counselling or therapy or whatever, anything, then chances are those feelings or behaviours or responses are being triggered by some kind of dynamic that lies below their conscious awareness. They're not in control of it consciously. That's where subconscious mind therapy has to happen.
This model of self-healing was developed over many years by Greg Bryce and the late Frank Wright.
Private subconscious mind healing is healing that is done within the privacy of the subconscious mind, which is descriptive of the therapy. It's done without the acting out and talking out and all that sort of thing of the therapies of the early part of this century. So many of the old techniques and hypnotherapy techniques and all that sort of thing were encouraging that sort of thing. We've had a lot of
They
fun.
realised that subconscious problems could not usually be resolved by using conscious mind talk therapy techniques.
Frank Wright and I were both working quite independently, using old-fashioned subconscious techniques, all kinds of different things, I guess, in our own separate but similar ways, both looking for better ways to help people, both with, or mainly with respect to getting permanent positive results and being able to do it easily. And strangely or ironically, we both came to many similar conclusions from, I guess, quite different ways. I can still remember the hackles going up on the back of my neck when he started talking about, firstly, that the client had to heal themselves and that the process had to be kept very private. And I thought, here's someone else that has understood the same sort of thing. From then on, we just started comparing notes and swapping ideas in the clinic, and P.S.H gradually evolved.
I would definitely say that Frank Wright and Greg Bryce were well ahead of their years and well ahead of the time, and they knew things simply by looking at the way people worked. And now science is finally catching up and it is demonstrating that what they knew to be true is correct, and that's why it is so helpful to so many people.
With the guidance from a qualified P.S.H therapist, a person can do this simply and effectively.
I guess in a way everyone that walks in my door, I'm helping them with post-traumatic stress to some degree. What we normally call and think of as post-traumatic stress is it's exactly that. It's where the subconscious is still responding to something today that happened somewhere way back. We can't turn the clock back and change the history. We can't change what's happened. But the client, it seems to me that the client changes primarily their subconscious view of those events.
Processing is a normal, natural thing we do all the time. I'm sure we can all remember a time where we felt a particular feeling we didn't like, but after a good sleep or a few days later, we can think back on the experience and there's no longer a sting in its tail. So we're processing emotion all the time. It's just that sometimes things are so traumatic and overwhelm us that we can't fully process it at the time of the incident. One of my colleagues refers to it as ghosts in the emotional brain there. And, the incident has happened, it's gone, but it's the ghosts, it's the residual emotion that's causing us the problem.
It may be comforting to know that Western science is now beginning to have a deeper understanding of the connection between chronic pain and the emotional history of a person.
Often doctors will tell people that's just the way it is, you have to learn to live with it, especially with chronic pain. And yet that's not true in my experience and in the experience of the people that I've had the privilege of working with, that it's almost as if, at least I believe, that the emotional brain, say with chronic pain, that the emotional part of the brain is still responding as if the trauma is still occurring because it hasn't been fully processed. In which case the brain is sending out pain signals to say, hey, something's going on here, you need to do something about it. And yet when a person has been able to process that trauma, and I'm thinking about people in defence I've worked with, people in service personnel that I've worked with, even just children who've simply had a serious accident and really injured themselves and haven't recovered from the shock of it. When you give people the opportunity to process the emotional component of that experience, the brain can switch off the alarm bells, and the science shows that that's what's happening. The brain can actually switch off the alarm bells because the experience is done, it's over, it's no longer continuing, and the brain can calm down and the whole system can calm down with it.
For many of us, very strong negative emotions, be they conscious or subconscious emotions, if not resolved, can and do have a direct effect on the health of our bodies.
I'm sure that probably the vast majority of physical symptoms originate at a level of what we might say is subconscious level emotional stress of some kind. And I think, human beings, it's a little bit like we have a tremendous, most people, I guess, have a tremendous capacity to soak up a lot of emotional stress inside. And I think it's almost like it gets to a point where that part inside says, I can't handle it anymore, so now it starts dealing it out into the physical body. And then, anything that we might see as almost anything we might see as a physical symptom can become the result. And I think most people are like that. We can store up so much negative energy and stress inside until finally it's, I've had enough of this and now I'm going to get headaches or psoriasis or, whatever it might be. And commonly, of course, not always, but commonly the physical symptoms that do manifest from those sort of things, quite commonly there will be a predisposition for those particular physical things running through a family tree. And someone's going to say, oh, you inherited that. Rather than really, you probably inherited the predisposition for it, but you didn't inherit the disease or the problem. It's just that because of your family history and the DNA or whatever, when that stress gets too much, you'll get the headaches where someone else will get the heart problems. If we could unzip somebody and look down through all the paraphernalia and all the life experiences, and we could sort of say, aha, this is where it started, what we would always find is that the original subconscious level intention would have been a positive and probably a protective mechanism. And it probably worked at that time. Trouble is 10, 20, 30, 40, 50, 60 years later, it's out of date, it's become a nuisance, but the subconscious is still trying to protect the person. I've had hundreds of clients walk in and sit down and say something like, my subconscious is out to get me. And my answer always is, no, it's not. It's just doing what it's been taught. And the fact is, maybe it's a bit glib to say it, but if you teach the subconscious good stuff, it'll give you good stuff. Teach it bad stuff and it'll give you bad stuff. But it'll always do it 100%.
Subconscious problems do not need to be brought to the conscious thinking mind in order to be resolved.
What's a wonderful thing is that the people that come and see me are often relieved because they do not need to be re-traumatized in order to heal. They don't need to relive any experiences. They don't need to talk about it. The therapist has no role in whatever's happening in the person's mind. That's a completely private thing. Simply the therapist is there to guide a person to do what they can naturally do.
So I first realised I needed to get some help because life had sort of got a bit too much for me. I was running 4 businesses, trying to be a single dad, had a partner with a child as well, so a blended family. And prior to that, I had a lot of issues personally in my life. So I had severe abuse as a child. My sister was also abused as a child, who ended up committing suicide at 37. Family broke down, and over time you sort of realise that you can't handle all of these things on your own, and without dealing with it or getting help, it was all starting to bottle up and come to a head where I was sort of in a pretty dark place for a period of time. I was feeling all these things and life was getting a bit much, and I had the therapy. So far I've had 2 sessions. What I've noticed now too is even the anger obviously has dissipated. My anxiety levels have also dipped, so I'm feeling obviously less anxious, not as self-conscious about things as I was. And if situations come up where previously they would make me pretty anxious, I'm tending to sort of let them fall away now. Yeah, it's a very different therapy than I've ever had before. Traditionally I've sat and talked, and being a male, middle-aged male in Australia, I don't particularly like that. I don't want to talk about things, I don't want to talk about my problems. So it was refreshing to go to a place where there was no talking involved. It operates on a subconscious level. And as I say, it's not an immediate thing where you wake up and feel completely different and operate different immediately. It doesn't work like that. But to be able to walk out, close the door, go home, rest, was really, really good. I really enjoyed that process.
The therapist's primary role is to help their client utilise their own healing abilities. And in accordance with the client's wishes, the therapist gently guides the person in a process where they can mobilise their own inner wisdom and healing abilities.
What I call the 3 essential principles of subconscious change are very simple. First one is pretty obvious, that the client they've got to want to change in the first place. And I guess they've got to keep on wanting to change until they have made the changes. The second essential principle is they have to be willing to, what I normally say to a client is to open up the channels of communication within themselves so that the part that can make the change actually gets the message and can do it. So they've got to be willing to do it, or they've got to be wanting to do it rather. They have to be willing to do what's necessary to give the subconscious the opportunity to make the changes. And then thirdly, and very importantly, they have to be patient and trusting and patient of that subconscious process. We have to treat our subconscious with a lot of love and respect, and we can't sit around bullying it and kicking it and then expecting it to change things. When we've established that they need some sort of subconscious change, it's very simple. I guess the key words are to focus uncritically on what they've got to do within themselves.
I've often worked with people, and in particular in recent years, people who've been in therapy of some description for maybe 20 years. And I can think of a few people, even as I'm saying this, that come to mind, where they are dumbfounded at the difference they can feel within a very short space of time, because we're all set up to believe that if it's been around a long time, that it will take a long time to process. But we can process things in the blink of an eye when we're given the opportunity to do so.
They're bypassing the critical part that sits up there in judgment and weighs up the pros and cons and says, no, I can't do that. You know, there's a part of all of us that if you've got to change something that's been there for 40 years, there's a conscious, critical part that'll say, well, don't be silly, I can't go, I can't even remember it. But the subconscious part doesn't think like that. So when the client is able to be, when we guide the person to a way of thinking that I guess bypasses that judgmental part, it's like the subconscious says, oh, okay, and does it. And I've seen people almost jump out of the chair, you know, yelling, if I am healed. Usually they're not, but I have seen people change things very, very quickly, and some people do it quite slowly, and most people do it somewhere in the middle. But I would be very disappointed with most clients. I'd be very disappointed if I wasn't, or if they weren't starting to notice changes of a positive nature within at least 1 or 2 weeks or something like that after I've finished seeing them, and quite commonly after I've seen them the first time.
So I think one of the biggest differences in the way or in the approach that we take is that we help a person to do their own healing. It has absolutely nothing to do with the therapist. I cannot make someone heal. I can simply guide them and help them to do their own inner healing by reorganizing, if you like, the way their brain is working, to allow new neural pathways to open up and to close down neural pathways that are no longer serving them.
I started to notice more changes sort of 4 or 5 days after, and then in the coming weeks, just that ability to control how I was feeling. Well, it just wasn't taking over me anymore. What I've found is through the therapy, it's given me the strength to be able to know what I want and be okay with asking for that. And it doesn't matter who that is, if it's what I need, it's what I need. And so over time, I've noticed without the anger and the anxiety being a dominant part of my life, my energy levels are starting to come back to where they should be. I was walking around with a fog for 9 or 10 months of my life where I couldn't think, wasn't feeling properly, I was sort of numb. And I'm a creative person, so that was debilitating on so many levels, even being a father, a partner. So I'm finding now my energy levels are rising. I'm coming up with ideas again. I'm implementing ideas. I'm seeing that things are more possible. And so, as I say, it's been a process just to let happen, but I can feel the changes. I think the therapy over time, yeah, it's because it's subconscious, it's not happening and it's not something you're aware of. I think you can actually deal with those situations better in most situations in life. And the thought of me having to sit and go through intensive therapy about, you know, what happened to me as a child, or why my sister committed suicide, or, you know, why the family breaks down, all these things, it's actually made me, because I don't have the anger there shading my views or the anxiety, I'm realizing that, you know, I was a lot of the problem in those things. Not the abuse as a child, obviously, but in situations in my life, I've now realised through the therapy that because I don't have those things, I probably wasn't the best person to be around anyway. And now the therapy sort of let me realise that there's actually a better me, a better person in there, and I can move forward with strength, knowing that, you know, I don't have to blow up if something doesn't go my way, or I don't have to suffer from anxiety because I'm scared of the outcome all the time. So it's given me a real freedom.
The P in P.S.H is private subconscious mind healing, and so many people come to me, and the reason is because they don't want to sit there and go over and over and over all the past. I don't have to delve into all the nasties from their past in order to help them. Neither the client, neither me, the therapist, or the client has to go into that. It's all there.
There has also been something else very special to have come from the P.S.H model of subconscious mind understanding. Calm Birth is Australia's scientifically proven and trusted childbirth education program, being recognised and utilised in several leading Australian hospitals, with more following. Calm Birth, as the name suggests, prepares expectant parents emotionally, mentally and physically for a calm birth. It recognises the connection and power between a woman's emotional state and the way her body responds during childbirth. Peter Jackson, an experienced midwife and P.S.H therapist, developed Calm Birth with the help of P.S.H co-founder Greg Bryce.
It should not be a horrendous experience for a mother to birth a baby. I don't think nature got it that wrong. So that led me more into the mind-body connection, which led me on to do the P.S.H work, which again, with the help of Greg, we modified to build a program of helping people tap into what I call their inner resources to create the birth experience. It's sort of designed around the mind-body connection, and while we talk about the physiology of birth and help mothers understand what's happening in their bodies in a simple way, we also employ a number of, I call them inner journeys, where we first of all show them that they've got these resources within themselves, and we eventually work into a part of the program where we introduce the inner resource of healing, but emotional healing. So then I started to apply all that to kind of building the program with the help of Greg, we call Calm Birth. So many women have been, programmed about childbirth in the wrong way. And we medical people at times, because we see it, we perhaps sometimes perpetuate the whole idea. Any event, a baby is in the emotional currents of the mother. And so we're talking about emotional healing. Those emotional hormones, the communication hormones, transit the placenta, and so we can be setting up. So if you've got a mother who's extremely fearful and anxious and carrying a lot of emotional rubbish with her, we're already setting it up the wrong way. So to me, that's why I see the wonderful contribution of Calm Birth. It's undoing the knots of the heart so that they can be more at peace in the present.
Research shows that women who have completed the Calm Birth program, in comparison with women who have used more traditional methods, are more likely to leave hospital within 48 hours of giving birth, less likely to need medical intervention, and if they do, they remain calm, use little or no drugs during birth, and report feeling more in tune with their bodies. They also feel more prepared for parenthood. Letting go of emotional discord and conditioned beliefs can be a step on the path to transformation, and for many of us it is an opportunity to feel whole, to create abundance, and to realise inner peace.
If I was asked to summarise P.S.H, what we do with it, it's a case of people coming to us for help to solve problems, the symptoms that they've been stuck with, things that they've not been able to change using conscious effort, willpower, drug therapy, whatever they may have done in the past. And if we can establish, as we usually do, that it is indeed something that's being driven by a subconscious dynamic, then our job is to help them create an environment in which they can bring about change to that subconscious part of themselves. The subconscious part of them has to be the part in charge. It's the part that's got the answers. It's the part that has the resources to do it. My job, our job, is to, as much as anything, teach the client how to truly hand over to that subconscious part, and then to stay out of its way, to trust it, to be patient with it, and to allow it to do whatever it is that it's got to do, things we will never know about, to bring about those changes.